Hey everyone, this is Dr. Shubham. Today we'll discuss about air polisher from Waldent. This is air polisher which uses pressurized air and water along with a slurry of sodium bicarbonate to remove extrinsic stains, soft deposits, and is very beneficial for patients undergoing orthodontic treatment. It acts as an alternative to prophy cups and paste. So we now know where to use this, but it is also important to know where not to use this. It is contraindicated in patients with restricted sodium diet, hypertension, metabolic, respiratory, and renal diseases, and is contraindicated for patients with hypersensitivity of teeth. Coming on to the various aspects of this device, this is nozzle which attaches to the main unit like this. This is chamber to fill abrasive powder, and this is two-hole connection which attaches to your normal air rotor tubing. Now let's see its positioning. Tip of the nozzle is kept 3 to 4 mm away from the tooth surface, and each surface is exposed for about 2 seconds in a small circular motion. Do not spray directly on the gums or gingival sulcus. For the posterior teeth, on the buccal aspect, tip is kept in the middle third at an angle of 80 degree. And for the occlusal aspect, tip is kept at an angle of 90 degree. For the anterior teeth, tip is kept at an angle of 60 degree. Now we'll check its abrasive action. I'm going to fill sodium bicarbonate powder in the chamber and then tightly close the chamber. Now we'll see its effect on natural tooth surfaces. This is especially useful for proximal surfaces where scalar tip is difficult to reach. Here comes the most important part of the video, that is cleaning of this air polisher. This air polisher is supplied with these cleaning aids to clean it properly. After use, dump the remaining powder and clean the chamber with the brush supplied. Now it is to be dried completely using 3-way syringe. Now I am detaching the nozzle handpiece to clean it. Thanks for watching and stay tuned for more such informative videos.